Some women have had multiple miscarriages, and I'm sure they've wondered why it keeps happening. If you've ever had repeated pregnancy loss, the first thing I want you to know is this: it is not always your fault. In medicine, when a woman has 2 or 3 miscarriages or 2 or more miscarriages, we call it recurrent pregnancy loss. And that's usually when doctors begin to look for an underlying cause. So what could be responsible? Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound and women's health education. And in today's video, we will be looking at the reason behind multiple miscarriages or recurrent pregnancy loss. So what could be responsible? The most common cause is 1. Chromosomal abnormalities. Think of it this way. Imagine you are trying to build a house, but the architect gives you a faulty blueprint. No matter how skilled the builders are, the house cannot be completed correctly. The embryo, that is the baby, develops in a similar way. It relies on chromosomes, which are the baby's genetic blueprints. If there is a major error in that blueprint, the pregnancy may stop developing, leading to a miscarriage. Sometimes this happens completely by chance. Other times, one of the parents unknowingly carries a chromosomal rearrangement that increases the risk of miscarriage. Another possible cause is uterine abnormalities. The uterus is the baby's home for 9 months, so if that home is abnormal, if it has something known as a septum or dividing wall, or large fibroid mass pressing into the cavity, or scar tissues, or certain abnormalities, it may interfere with implantation or the baby's growth. This is one reason a pelvic ultrasound is often an important part of the evaluation. Another possible cause could be hormonal problems. Hormone helps prepare and maintain pregnancy. Conditions like uncontrolled diabetes, thyroid disease, PCOS, now called PMOS, or low progesterone levels may increase the risk of miscarriage if they are not properly managed. Another important cause is an autoimmune condition called antiphospholipid syndrome. In this condition, the body's immune system mistakenly increases the tendency for blood to clot. These tiny blood clots can reduce blood flow to the developing pregnancy, making miscarriage more likely. The encouraging news is that if it is diagnosed early, treatment can greatly improve the chances of a successful pregnancy. Another cause is what we call cervical incompetence. If miscarriage happens during the second trimester rather than the first, doctors may also consider cervical incompetence. This usually causes miscarriage during the second trimester, not the first. The cervix becomes open too early without painful contractions, causing pregnancy loss. Women with this condition may benefit from a procedure called cervical sacrilage in future pregnancies. This helps to keep the cervix closed. Another factor is age. As women get older, especially after the age of 35, the number of chromosomal abnormalities in their egg naturally increases. This raises the risk of miscarriage, although many women above 35 still go on to have healthy pregnancies. Another reason is lifestyle factors. Smoking, excessive alcohol, recreational drug abuse, severe obesity, and exposure to certain toxins can increase the risk of miscarriage. And finally, sometimes no cause can be found. This one can be very frustrating, but it doesn't mean that all hope is lost. Many couples with unexplained recurrent miscarriage eventually have healthy pregnancies as long as there is proper care and close monitoring. So where does ultrasound fit into all of this? Ultrasound cannot diagnose every cause of recurrent miscarriage, but it plays a very important role. It can detect fibroid masses, scar tissues, some uterine abnormalities. It can monitor early pregnancy, and it can measure the cervix in women to watch out for the risks of cervical incompetence. If you've experienced repeated miscarriages, please don't blame yourself. Recurrent miscarriages have multiple causes like I have listed, and many of them can be investigated or treated. So speak to your healthcare provider so that the right tests can be carried out on you and you can receive the treatment or care that you need. Remember, recurrent miscarriage does not mean you can never have a healthy baby. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and I'll see you in my next video.